Teton White. Our contestants are Hannah Antonsen, Samsara Mela, who is our returning champion, and Delaney Beadle, who's also a contestant. Our coaches are Jen Swanson and Jane Laurie, and our mentor was Tyson Judd.
And our host is Daniel Appleseed.
Okay, let's get started. Since you are a returning champion with a total of $6,000, you'll pick one of these categories.
I'll take neuroscience for 100.
Definition of neuro. Samsara.
What is having to do with the nervous system?
That is correct. Your board.
I'll take metabolomics for 100.
Overconsumption of this nutrient is linked to obesity. Hannah.
What is lobster?
Incorrect. Samsara.
What is sugar?
That is correct.
Metabolomics for 200.
This protein regulates glucose and fat burning. Blaine.
What is insulin?
That is correct.
I would like to choose random facts for 100, please.
One of 6 founding editors with the Journal of Computational Neuroscience. Hannah.
Who is Dr. Miller?
That's correct.
I choose neuroscience for 200.
A high-frequency sound that students can hear, but older teachers can't. Yes.
What is mosquito ringtones?
That is correct. Your pick.
Metabolomics for 300, please.
Fatty acids that have to be eaten in the diet because the body cannot make them. Samsara.
What are essential fatty acids?
That is correct.
Neuroscience for 300.
Often finicky eaters, these people have more taste buds than most. Samsara. Hannah.
What are super tasters?
That is correct. Your pick.
Oh, random facts for 200.
These were used as erasers before erasers were invented. Hannah.
What are breadcrumbs?
That's correct.
I choose metabolomics for 400.
Improved memory and faster reaction times can result from this supplement. Samsara.
What are omega-3 fatty acids?
Correct.
Metabolomics for 500.
1-to-1. Samsara.
What is the desired omega-6 to 3 ratio? Metabolomics for 1000.
A fatty acid with multiple double bonds. Samsara.
What is a polyunsaturated fatty acid?
Yes. And now we will take time to meet our contestants. Samsara, we'll start with you. Can you tell us a little about yourself?
I'm an 8th grader in Augusta, Montana. My hobbies are reading, hiking, lobster fishing, playing with my dogs, and skiing.
You heard 5 out of 6 questions in metabolomics. How is it you know so much about the subject?
I know a lot about metabolomics, except for how to pronounce it, because I attended a BioScience class at MSU in Bozeman. After the conference, I worked with fellow students to analyze diets.
Next up, Delaney Beadle. I've heard that you take an interest in rock climbing.
Well, not exactly, Daniel. I went to a conference in Bozeman and my male colleagues forced me to go to the Spire Rock Climbing Center, and I actually quite enjoyed it.
And last but not least, Hannah Antonsen. Hannah, you seem to be quite a lobster enthusiast.
I don't know what you're talking about. I don't like lobsters at all.
Can you tell us something else about yourself?
I once diagnosed a patient who presented with complaints regarding a metal plate in his leg. Through a series of agar plate cultivations, I found that he had Streptococcus epidermis with E. coli present.
Blaine?
Are you a doctor or something?
No.
Well then, it's time to get back to our board. Samsara, it's your selection.
Random facts for 300.
This flower child obtained his PhD from the University of California, Berkeley in 1966. Hannah.
Hashtag what is lobster?
Incorrect. Blaney.
Who is Dr. Edward Dratz?
That is correct.
I would like to choose random facts for 400, please.
I hesitate to articulate in fear I may deviate upon the highest degree of accuracy. Hannah.
How a professor says I don't know. I choose neuroscience for 400.
Region of the brain where memories are formed and stored. Blaney.
What is hippocampus?
Correct.
I would like to choose neuroscience for 500, please.
Diabolical device used to make facial sensitivity masks. Hannah.
What are lobsters?
Incorrect. Samsara.
What is a ninja throwing star?
Incorrect. Blaney.
What is a tactile probe?
That is correct.
I would like to choose neuroscience for 1,000, please.
A technological device that can help. A technological device that can help patients with amnesia. Blank.
What is a memory card or SD card?
That is correct. Interesting. As we look at the board, no one seems to want to touch infectious diseases. We'll need to break here to have a word from our sponsors.
As a dental professional, I just wanted to speak for a moment. Many teenagers drink up to 400 ounces of Mountain Dew or other sugary beverage per day. And I know that the sugars present in these beverages will feed the bacteria in your mouth and increase your levels of tooth decay. Rather than drink your Mountain Dew, I recommend drinking water and using a xylitol mouthwash. Xylitol is clinically proven to reduce the levels of bacteria in your mouth. Thank you.
Smile, smile, it's xylitol from Pesa Dental.
Disclaimer, this product is not to be used in infants who do not have teeth. Some users may experience spontaneous spitting from the taste of xylitol. If spitting lasts more than 24 hours, please seek help from a medical professional. Product not to be used in place of routine brushing. Product may taste like lasagna depending on how your taste buds perceive lasagna. This is an unintended side effect of creating dental rinse that reduces and inhibits bacterial growth.
Back to our board.
I would like to choose random facts for 500, please.
Won the 2008 Center of Biomedical Research Excellence Young Investigator Award. Hannah.
Dr. Jovanka Voyage.
That's correct.
I choose infectious disease 100.
Number of infectious disease hypotheses tested by Teton White. Samsara.
What is 2?
That's correct.
Infectious disease for 200.
A sugary soda hypothesized to increase mouth bacteria by Teton White scientists.
What is Mountain Dew?
Correct.
I choose infectious disease 300.
Fall sugar used in oral rinses inhibited bacterial growth in mouths of Teton County test subjects. Blaine.
What is xylitol?
That is correct.
I would like to choose infectious diseases for 400.
True or false? Students with braces in Teton County have more bacteria in their mouths than those without braces. Delaney?
What is both? The results were inconclusive. Each individual had different levels of bacteria that didn't seem to relate to braces versus no braces.
Good.
I would like to choose infectious diseases for 500, please.
Agar plates used to grow mouth bacteria by Teton white scientists.
What are TSA and VHI?
That is correct.
Infectious disease for 1,000.
Bacterial species that are most responsible for tooth decay and cavities. Hannah?
What are lobsters?
No. Delaney?
What are Streptococcus mutans? I would like to choose random facts for 1,000, please.
Sea creature whose color was misrepresented in The Little Mermaid. Hannah?
What is King Titan's beard?
Incorrect.
What is lobster? Wild lobsters are blue, green, and yellow.
Correct. Final Jeopardy. Educational opportunity comprised of 3 science experiences over the course of a year, with experiments, hands-on exploration, video conferences, online discussion, and technology development occurring throughout the year. Yes.
What is BioScience?
Today. The game is over, but the learning will continue. Let's add up the scores. Never mind, I have a lobster. Yeah. Are there any questions?
Where can I get that program?
I just searched Jeopardy game online.
Awesome.
Any other questions?
So you guys tested the effects of xylitol? Was that part of the experiment?
We had our subjects swish with a regular base and then with Mountain Dew. And 2 hours later, we had them do another base, and then they did xylitol.
They did Mountain Dew before xylitol, and we had them swish every 2 hours.
Then did the mouthwash out?
Yes, it did.
It seemed to help.
Ryan.
I sort of did that test thing, but I sort of also ate food before, so it kind of messed it up a little bit. But it tasted good, and the Mountain Dew was great. But yeah. So yeah.
Could you tell us a little bit more about some of the limitations you experienced?
Well, some of the people that we tested didn't follow our procedure. They ate in between, or like they drank something they weren't supposed to. And then our results were inconclusive because people didn't swab their plates at the same time, or they didn't track what they were at that time. And we couldn't figure out if 2+ was an actual 2+, because we all have like different, like how we see a 2+.
All of the temperatures in our house were also different, so it was not exactly great for growth because the different areas were not the same. Are there any more questions? Thank you.